What happens to the price of a drug if the pharmacy switches manufacturers? Okay, first of all, if the pharmacy switches manufacturers, it's usually a generic drug issue. It's not a brand drug. There's usually only one manufacturer for a brand drug. Now, if the pharmacy changes, and it's not always even the pharmacy's fault, sometimes it's some other cogs in the wheel between manufacturer and pharmacy. If you have no deductible or you're past your deductible period and you just have a copay, you're most likely not going to notice anything because copays kind of stabilize the price a little bit. However, if you're in a deductible period and that drug counts as part of the deductible, when you change manufacturers, that means you're going to be changing the cost of the drug. That means you're going to be changing that new cost. If you have a co-insurance plan after the deductible is met, co-insurance means you're paying a percentage of that drug's cost. When the manufacturer changes drugs, that means you're going to be changing the co-insurance. You're going to be changing what your portion of that cost can be. Sometimes it can only be $1 or $2. Sometimes it can be significant. It could be a lot more. So that depends on what's going to happen. But all these things can happen if a manufacturer changes the cost of the drug. Even though it's the same drug, when it's a generic drug, there can be multiple companies making the exact same drug. And if you have a co-insurance plan, that means the percentage of what you're going to have to pay is going to change based on what the manufacturer is charging for that drug. Not much you can do about it if that happens. There are a few things. However, when manufacturers do change, that does change the cost of the drug. Whether you see it or not, the cost of that drug will change.